Acid attacks after meals, your acid pocket explained. If after meals you notice not just acid reflux, but also shortness of breath, tightness in your chest, pressure in your chest, maybe shortness of breath, anxiety, heart palpitations, your acid pocket could be to blame. So what is that? When you eat a meal, the contents that goes in your stomach, the meal, is under a little pocket of acid that doesn't mix with your food. It just sits on top. And that's normal. That's what it should do. Problems arise when your stomach has pressure placed upon it, which is not normal. And that pressure forces your stomach up, and it forces that acid pocket up. So now that acid pocket has breached what's called your anti-reflux barrier. You have one in your diaphragm, your breathing muscle, you have one at the base of your esophagus, all designed to prevent reflux. But when that stomach gets compressed and pushes up, the acid pocket comes up, and now you feel that irritation and burn in your esophagus. But what causes the rest of the symptoms? That irritation of acid to your esophagus, which of course shouldn't be occurring, sets off reflexes, nervous system reflexes, and this is via your vagus nerve. And these reflexes irritate your heart, causing heart palpitations, and they irritate your chest, your diaphragm, and you can get the shortness of breath, the chest pressure, and also a feeling of anxiety. So all of these are very real. It's not in your head, and there's, your heart. As I'm explaining this, I want you to know that I have assumed you have been checked out by a cardiologist. If you have heart symptoms, you have the shortness of breath, you have the heart palpitations, and your heart has been checked out and you're told it's fine. That's what happens in this scenario, which is that the first thing that gets people's attention is, of course, the heart palpitations. Heart disease is our #1 killer. But when you go and you get your heart checked out and you're told it's fine, but you still have these heart symptoms and you still have chest pressure and you still have shortness of breath, you start to wonder, what's wrong with me? Am I making it up? And you're absolutely not. This is a known reflex that occurs between the esophagus, the vagus nerve, and creating these symptoms. So what does one do about it? That's the key. So we have to get to the root cause of the pressure. So that excess pressure in your abdomen that's pushing on your stomach and creating this elevation of your stomach and this cascade of symptoms. So the root causes of pressure, there are several. You want somebody to help kind of suss this out for you and see what's true for you, but I'm going to give you some examples of what it can be. You can have bad bugs in your colon, and those are creating inflammation and pressure. You can be chronically constipated. You can have a high processed food diet. You can hold a lot of weight in your abdomen, and that's causing pressure. You can wear really tight clothes. You can bend over on a full meal. These are some lifestyle habits that are very easy to fix. You can lie down with a full stomach. All of these things can aggravate. But then deeper, we have toxicity levels that can be at cause. Anything causing inflammation in the gut, as I mentioned, the bad bugs. There can be food sensitivities. So it's not an endless list. It's a decent sized list, but not something that's difficult to figure out what is true for you. And there might be a few of these things that are true for you. So that's the solution. It's not difficult, and I'm not giving you medical advice. I'm giving you education here. So now you have to find somebody who can help you. But hopefully it will answer that question that I'm asked so much, which is that my doctor doesn't understand why I'm having these symptoms, and they tell me sort of nicely, it's all in my head. And it's not. You're really experiencing this, and there's a very good scientific reason for it. And I have many scientific citations in the description of this video. So I hope this helped. Send it along to somebody else you know who might be suffering. And if you like the video, give it a like, subscribe, and then send me a comment, because I love your comments. All right, we'll talk soon.